So, hey, thank you. My name is Tex, and appreciate you stopping by today. Today, I'm going to talk specifically about trauma, trying to help find a reasonable definition, a way to understand it, to maybe help figure out if some trauma is affecting you and how you're interacting with the world. It's having an influence on you or shaping you, or maybe someone else in your life that's important to you that's dealt with trauma. The way I want to start doing this is actually taking, that basic definition of trauma, and there's first breaking it down. There is physical trauma, and this is easy enough you to understand. If you had physical trauma, it means you were injured. In other words, you got hit. There's damage to a certain part of your body. People have traumatic brain injuries in which their head was hit and it affects them, mentally, being able to understand, think, their cognitive processes, or even hits them at an emotional level and literally throws off that process within the brain. There's also traumas to the body, like breaking a bone. Separate from that is the psychological type of trauma. And this is when some type of injury occurred to you that was very upsetting, frightening, deeply disturbing, and somewhere in your past, maybe recently or a long time ago. There's the type of traumas that are single event, like a really bad car wreck, or there's ones that are multiple and complex where you had a series of things happen over time. So what I want to do is actually go through and let you see what it feels like when I'm doing an intake. That's an evaluation when someone comes in and says, "I think I need help." I ask a lot of questions, and part of it is a trauma block where I ask questions specific to trauma. Now, I usually ask this after I've already asked some questions and I have some understanding of your, physical problems and, the different systems of your body. How are you doing? And then I also check, for previous diagnosis. And I work my way around, do a mental status exam. And after I've done that kind of stuff, then sometimes you might have already mentioned it while I was doing that there are things that gives me a clue I need to ask more questions about when I get to the trauma block. Now, it could be when you came to see me, you first wrote in, I got some trauma. I got something that happened to me. You may not say I have trauma. You may say I had something happen to me. I got divorced. I got separated. Someone close to me passed away. I was in a bad car wreck. I got physically attacked or assaulted or sexually assaulted, or things happened to me as a child or a teenager. And the thing is everyone's trauma is specific to that person. See, that's the first thing I have to shift people's mind away from thinking that all traumas are the same, and they're not. And all people are not affected by traumas in the same way. A lot of times it has to do with what coping skills you bring to the table to deal with the trauma. So I'll get into more of that later, or maybe in the next video, when I actually go into types of trauma therapy. For this one, though, specifically, when I get to that trauma block, what I do is I explain to people as I'm getting there that the questions are going to be very invasive, and for that, I apologize up front. I always tell people, and I also explain to people that if it gets too emotional, let me know, hand signal, because some people will get emotional and can't speak or talk, or at least can't articulate. Give me a hand signal, just say stop, or can we come back to that? Or I'll tell people you don't have to give me specific details at this time. I'm just trying to get a picture of, is this an area that we need to talk about? It may not be the area that you want to work on. A lot of times people come to me and in their mind, they're wanting to deal with either grief or sadness or depression or anger. It's my job to start separating things apart and looking and seeing what may be causing something else. What may be the reason that this is occurring? So when I get to that trauma block, I'll specifically then break it down and I'll say, first, I want to break down abuse. Abuse is not just physical abuse, but it could be verbal or mental abuse. And in that sense, I break it down in stages and I say, as a infant, child, adolescent through your teen years, coming up into adulthood, did you ever experience abuse or neglect? And when I say abuse, I have to break that down, like I said, to physical, mental, or verbal. And because some people will not consider things to be abusive, or at least they will not think of them as being bad enough to say anything. You know, again, every person is unique to their experience. And what kind of discipline measures from whatever culture or group that you come from, there are, ways that people react or do. You may have certain punishments that you get, or consequences, as the fancy word goes, that had a long lasting effect on you. And I'm not, first, when I ask this, I don't blame anybody. I'm just sitting in a space accepting what you tell me. And if whatever you tell me is what I put down on the paper. So as a kid, these kinds of abuse could also be in the form of not just from somebody in your family or somebody that was a caretaker over you, babysitters, but this could go out into coaches or teachers or clergy or anything out that involves somebody interacting with you. It could also, though, be specific to maybe being bullied or picked on. And I don't judge how the bullying affected you now, and I don't try to judge whether or not it really is bullying or isn't, or abuse or not abuse. I just take what you say and I sit with you and basically, okay, fine, this is what happened. The reason I do this is because every person, to them, how they reacted is specific. What happened to them, how they dealt with it over time. Because it's not just those things of abuse, but maybe it's also loss. And I break that down and say loss of a loved one, someone who was close to you. And that could be a good friend, not just a relative. Or it could be a relative that may be distant, but one that was very involved in your life, or a caretaker, classmate. See, those kinds of things can be traumatic. And I just put them all in the block to look at them and see what's going on. Sometimes things may seem small in and of themselves, but when you do it in a series, then it kind of starts to wear you down. Just like a physical trauma. You may strain a muscle, and that's a minor trauma to the muscle, physical trauma, but then you strain it again, and then you trip and hurt it, and then something falls on it. And notice how each one of those events may have been okay by itself, but as you stack them up, they start to have consequences. A lot of times, something may be trauma or traumatic to one person, but not other people. Maybe you got picked on or bullied in a situation because you had the coping skills to deal with it, or you had people, friends, family, loved ones who stood behind you that you could talk to you, it wasn't really a traumatic event. Or maybe it was, and you put it aside and don't think about it. Or you told yourself, I'm not allowed to literally think of that as trauma because people will tell me, I know other people have had it worse. I know and you know what? That's true. No matter what you say, there's always somebody who had it worse. Remember what I said, though. It's specific to you and what you're able to deal with. So now you're starting to get this complete picture of what a trauma could be. Trauma could also be a natural disaster, living through tornadoes, hurricanes, earthquakes. It could also be fires, okay? Either the fires created by like in California that we hear about now, having your home destroyed. It could also be Traumatic in the sense that you actually got physically injured. And then I go into that. Physical injuries, going into the hospital, broken bones, surgeries. It could also be someone close to you who went into the hospital, and that was very scary for you. Then I keep moving through these list of things and going, then there's violence. And as you get older, any of those events could still happen, traumatic loss. Over that whole spectrum and into adulthood, there's also sexual trauma. And I break it apart like that. And I explain that anytime you felt you were unable to say no, and notice the specific way I worded that. I didn't ask for details. If you want to share them, I will take them and put them in my notes to help with your therapy. But at this point in time, I'm just trying to see if there's something traumatic. Now, there's different kinds of sexual trauma. There's military sexual trauma. Then there's the sexual trauma that occurs from molestation. Then there's partner violence. Partner violence can take any of the forms of abuse that we talked about: mental, verbal, physical, and then also sexual. So you have all of that. Then moving over, and if it wasn't a partner, you might be somewhere where there's community violence. Growing up in an area where people either might be committing criminal acts right there in front of you or on the street. You might be a witness to something, crimes going down, people selling drugs. You might feel unsafe in your own home, because then here's the next part. Did you ever have anything happen to you, like someone break into your home, hold you at gunpoint, knife point, physically attack you, rob you? It could even be threatening calls. See, there's a huge area that I just keep expanding into. And the reason why I expand into it and just saying, have you experienced any trauma? You may not think of it as trauma until you actually start to think about it and go, well, after that, I did act different or see people different, or I handled the world different. How I felt about myself was different. See, now we're understanding how that event, that thing, whatever it was, has now affected you in such a way that it carries over. And I keep expanding on that, going, being a witness of it happening to somebody else, being in a bad car wreck, okay, or seeing someone else in a bad car wreck, seeing the results of violence done on somebody else, even if they're not close to you, sudden loss or death of someone that was close to you. So witnessing those, so notice how now it's violence and loss, and basically anything that would change your life. And as I go through that list of things, I'm paying attention to you to see how you react. Because sometimes you will say no, but your body says yes. Now, it's like a clinical judgment in my mind. Are you doing this because you don't want to share the trauma with me, which I'll say right up front is perfectly fine. We don't have to talk about it now. And if you don't want to talk about it, we won't. Maybe you want to talk about it, but don't know you want to talk about it because maybe you never thought of it as trauma. I tell the story specifically of a family that I worked with, and I was working with the kids, and I had asked about trauma and loss, and they were all like, none, because in their mind they saw trauma as something being done to them, attacked or hurt or molested or beat up or bullied. They didn't see it as loss. The mom was over in the corner crying. And I looked and I said, hey, what's up? And she looked at the kids and she says, your dad died 6 months ago. And I cried that day. Whew. Because then the kids washed out. And she told them, she says, y'all cry every night before bed. In their mind, though, that was just the way it was, and they didn't see it as trauma. And I get that. And a lot of people don't see things that are traumatic as trauma. Like, yes, doesn't everybody grow up in a neighborhood like that, or doesn't that happen? Specifically, with the recent weather issues, uh, the, the idea of, hurricanes coming and, people should pack up and leave and all these things that you're told on the news. And I remember as a kid, I think I sat through about 3 hurricanes, several tornadoes. Used to live in a trailer home when I was growing up, and we moved out and we came back to visit the neighbors 2 weeks later, and our trailer looked like someone had crushed a Coke can because a tornado had picked it up and literally just crushed it, bent it in the middle and crushed it. And I was like, wow, that's cool. It was traumatic, but it didn't affect me. And see, now you're starting to get it. I'd seen, tornadoes. As a kid, we had tornado drills. Somebody else who might have never gone through that though, and they're seeing a tornado come, it may totally freak them out. Or how the people around you handled it. And again, I go back to different types of trainings, and one of these was, a discussion about when Anna Freud, Sigmund Freud's daughter, studied the survivors, the children of the bombing of London, and how the kids reacted depended a lot on how the parents reacted. And those kids whose parents, the stiff upper lip, this is the British way, and we have our tea and we don't let this affect us, and it's all just natural and calm, the kids tended to do a little bit better. Those parents that were feeling the effects of the trauma and fear get passed on to the kids. And in another video, I've already talked about how sometimes you have transgenerational trauma that gets passed on. So that could be something that your parents or even your grandparents faced, and it has an effect on your life because it affected how your parents raised you. And I'm not saying good or bad. I'm just saying that you felt what they feel. So those are some things that are specific to what is trauma. I wanted to get into more detail of how I do the trauma intake, asking those questions. Because then after that, if there was any events that came up, then I might ask specific questions. Like my specific question might be, do you have nightmares or bad dreams? And notice I had to break that down, because a lot of times if I just say, do you have nightmares, people go, no. And if I go, do you have bad dreams? Yeah, sure. How bad are the dreams? Oh, they wake me up. You ever wake up screaming? Oh, yeah. Um, wouldn't you call that a nightmare? In their mind, though, it's not that bad. They've been doing it for a long time. I will ask if you have intrusive thoughts about the event. In other words, if something occurs that reminds you of that event or something in that event, or maybe not specifically to the event, but you just have the feeling. Maybe you had a really, really, bad car wreck. And now when you hear tires squeal or lights flash or sirens, you feel unnerved. See, that's an intrusive emotion that even is different, similar, but different than the thought. Some people will say, well, I can't explain it. I'm like, okay, but every time you hear sirens, you feel, closed in or hurt or pain or neck pain. See, that's how those trauma memories are now placed in the body, and they're recalled when triggered. Then I will actually break down and go, okay, now when you have these things happen, these intrusive memories or feelings or thoughts, do you have flashbacks? And I ask that specifically that way, and I explain what a flashback is. It's a loss in time, in the sense that you feel like right now it's happening just as if it happened way back then. So now you have See, we're starting to stack on the symptoms and understand what can happen from trauma. You could have any and all of these, even to the point of where you could dissociate or blink out or lose track. Sort of like you get caught staring off into space for a second. You lose track of what you're doing. So those are the effects of trauma. And as I'm asking that, sometimes they'll tell me they didn't have trauma, but they have all these trauma symptoms. Maybe they don't specifically have that, trauma memory they can pull up right now, but they know something happened. Because sometimes the traumas are pre-verbal, which means before you had the ability to talk, something traumatic happened. And yes, you can kind of remember something happened, but you can't express it because you didn't have speech and the ability to communicate when it happened. And now when you try to pull up that memory, it comes as a memory of feelings and emotions, but not words. I hope that helps a little bit understanding all the different kinds. And I haven't even touched on every kind of trauma. A lot of times I'm looking to see how you respond to these questions, to what's going on. And sometimes, like I said, I've already got clues because by the time I get to this part of the intake, I've already asked you a little bit about your family history, and I already know a little bit about these things, and I know a little bit about your physiology. So, a lot of times things that are wrong with the body, like headaches, poor sleep, they may be indicators of trauma. And then I'm going to delve into that when I hit this trauma block and go, okay, is there anything that's going on when you feel these things? So, and again, someone who's had a lot of trauma in the past, then when they have a more recent trauma, they may not handle it quite the same way as other people who didn't have this stack up. In other words, if you felt, and see, here's where it can be the breaking point for some people. If something happened to you that was traumatic and you had the right support, because the people there, either by sheer luck or by practice, knew what to do to support you and help you through it, then you in your own mind gain a measure of self efficacy that you can work and do, and you feel like you can overcome this, and you do, versus somebody that something traumatic happened and maybe they didn't tell anybody ever. Okay. Or maybe they told and they come from a family who did the shh, we don't let anyone know, we don't talk about that, or we don't let anyone outside the family know about that, and they never sought help and they never did nothing. Or maybe the family member or the person just didn't believe you and said that that didn't happen. So you didn't gain those small victories over your trauma that allow you later to have the confidence and the understanding and the capability to overcome the traumas later. That's why I said every trauma is specific to the person, because everybody's uh, how they recover physically is different. Everybody's energy level is different. Everybody's background and upbringing is different. I mean, there really are so many factors that go into determining how you react to the trauma. And just because you were able to overcome it, or you overcome it in the past, you know, it's a good sign that you'll be able to pull through better in the future. It's not guaranteed though. And that's why I said everything is specific to you, specific to what you're doing, and specific to how you're handling things. Okay. And it's also not just the trauma itself that's specific, how you react to it's different. Your basics, support network that you have now to help you with it, where you're at in your own life. All of these things make your trauma specific to you. And that's why your therapy gets tapered to you. And I'll go over exactly what kinds of therapies I know about that are trauma specific or trauma informed type therapies in the next video. And I hope you join me for that. You have a great day. And if you have any questions, feel free to ask. Thank you.